Hey everybody, happy Wednesday. I hope you're staying nice and cool in this interesting weather that we're having. Today, I want to bring a couple of things to your attention and talk to you about doing some reviews and doing some checking in because we are now in month 7 of the year, which means that we are now in the second part of the year. And this is what's important. A couple of things that I want to share with you. First of all, July is a National Sandwich Generation Month, which means that sandwich generation is going to describe individuals who are simultaneously caring for aging parents and also still supporting their own parents. It's kind of like they're sandwiched together. And this role can be very taxing emotionally and financially. And it's just a note to put your attention on this for a variety of reasons. Make sure that if you are in this position, that you are taking the time to take care of yourself. There are support groups that are available specifically for those that are in this position. A lot of them are women. So I encourage you to find the resources and the help. And of course, if you are looking for this help, please reach out because I know I have some of these resources in our concierge database. So that's one. Number two, my other suggestion to you is, because we are mid-year, is for you to take the time, make some planning, put it on your calendar, and get your records all organized between January and June. So for the last 6 months, get everything scanned in, organized, kind of separated depending on how many things that you have, if you have a business, if you have investments, things like that, because it's going to help you when January comes and you're getting ready for the tax season. It's going to be less hectic for you to scan things and get everything organized for your appointment with your accountant. So it's not going to be as overwhelming during that season. So think about scanning things and putting them in separate folders. It could be maybe investments, it could be expenses, things that you need to track, but take your time. I actually am a fan of using a spreadsheet that I keep track of what I need for whoever is in whoever is the family member, what do they have going on, and each of them kind of has a list of things that they need. This way it just makes things a little bit easier for you to breathe in January, not only because it's after the holidays and the bills are coming in, but you also are prepping for the time with your accountant. So those are the two things that I have for you. And of course, this is the time in the beginning of each month is where you should be looking into things that you need to do in your home with the home maintenance checklist. If you don't have one, I'm going to link this in the notes under this video, so that way you can print it out and put it on your refrigerator, and also put this in your Google Calendar so that way it reminds you. This is a great handy maintenance checklist that we created for our clients to help you maintain one of your most important investments that you have for your retirement, which is your home. There are things on the list that are separated by the monthly, quarterly, semi-annually, and then things to do on an annual basis. And the things that you have to do every month that I'm going to remind you is going to be cleaning your microwave and oven, clearing out your garbage disposal if you have one. Remember, if you have a private septic system, you shouldn't be using garbage disposal. Cleaning and unclogging your sink drains in all of your bathrooms as well as the kitchen. Vacuuming out, cleaning out your dryer lint trap. As you know, it's the number one cause of fire. So we want to make sure we keep that all nice and tidy. Also take a walk around the home exterior, especially if you've had any bad weather, storms, rain. Make sure there are no issues that are small now that you may want to take care of before it becomes an issue. Cleaning out your range hood filters if you're a big cook. So that is something that's on the list every month. For the quarter, I encourage you this month to replace your heating, your furnace filter, to make sure that you are breathing clear air. And the only other item that is on the list for this month for you to take care of is vacuuming and cleaning your air registers. People don't realize that you should be doing that because the air goes through it and you breathe that. So take a brush, put it on your vacuum cleaner, and just walk around and get that done. So my suggestion to you, again, is create that list, put it on your Google Calendar, and set a reminder for you to do this monthly. So If you want this, let me know. I can mail this to you, or you can download this from the link under the video. Also, I think it's cool that we talk about your mid-year review of your health insurance coverage. And the reason why it's so important is because we just keep going. We just live our lives, and if we have to go to the doctor or to the dentist, we just do it. However, there are some things that are important for you to keep track of, and especially now that you are in the middle of the year. I listened to a very cool podcast, and I'm going to link the episode so that way you can also listen to it. The actual podcast is called All the Hacks, is what it's called. And the host invites different professionals on different topics, and they talk about shortcuts and tips and tricks and hacks on different topics that pertain to everyday living. And I find it fascinating. They have different topics. And one of them that I listened to actually a while back, but I brought it back today to share with you, is a conversation about hacking healthcare, prescriptions, and medical bills. And there are some things in there that I found absolutely fascinating that I didn't know. So I'm going to share with you the link to that podcast episode that you can listen to. The author that was on there he's actually a healthcare journalist. He wrote a book about everything that he learned in his investigative journey about this. And I'm going to link the book for you. I found it very interesting. So I'm going to touch upon a couple of things that they're mentioning as we're going through. So with regards to your healthcare coverage, whether you're still working and you're planning for your retirement, or you are already retired and you're using Medicare, maybe supplemental insurance, all of these things are going to apply to you. So grab a notebook and jot some of these thoughts down. And if you have any questions, just let me know. The first thing I want you to do that's been recommended is review how much you have left to meet your deductible. If you have high expenses, most of the plans will have some kind of deductible. So take a look at it and see how much you have left. Or if you don't have any left, maybe if you already reached your deductible or you're close to it, then you can schedule appointments and do some elective procedures, some of the things that maybe you need by the end of the year before your deductible, of course, is going to reset again in January. So that is number one that you may want to take a look at. Also, check and see if your plan offers what's called a healthcare blue book. I found that interesting because it's a perk that is allowing you to search by procedure to see what is the fair price in your area, and you can look up the cost and the quality information for nearby doctors to perform a procedure. I thought that was interesting. So see if this is something that's offered. I think one of my peeves that I found is, as you can imagine, like if you're shopping online, we rely quite often on reviews by others on the products that we buy. Think Amazon or Walmart or Target. You like to read other people's reviews of the products that you want to buy to see if they like it. And then a lot of the times, if the product is quality and the reviews are high, it may influence your decision to buy, unless you want to also do your own due diligence, which is perfectly acceptable. However, if you think about it, and maybe let me know, but I have not found a database or a review system or anything where you could go in and say, you know what, I'm looking for a really good cardiologist in my area that has been reviewed by other patients, not other peers and other doctors, but other people that have used them that were his patients, that actually shows the quality of his work, his experience, and his education. I don't know if something like this exists. Maybe I'm missing something, so let me know if I am. And this is, I think, is one of the challenges, is that a lot of times we rely on recommendations from our primary care doctor, or an insurance company is going to recommend it to us because they have a database. But how are they recommending? All they're doing, in my opinion, is they're just going down and saying, okay, the closest doctor that you're looking for that specialty is going to be 10 minutes from the zip code where you indicated that you live. And here's a list of doctors nearby. That's all it is. They're not giving you any kind of reviews or experience or support information for you to be able to find a doctor that it truly is a master of their craft, who knows what they're doing, who is passionate about helping people. So that's one of my things that bothers me, I think, about one of the things that bothers me about our healthcare system is there's no way to truly find out which doctors are good, because I guarantee you, I've seen this with myself and my kids and my family, my parents, is that not all doctors are the same. And just because they went to medical school and just because they practice does not mean that they're passionate about and they really know what they're doing. So I think, and that's is similar how it is in other professions as well. So the other thing that I want to also bring up to your attention is, if you haven't looked into some of the wellness benefits that may be part of your insurance plan, please check them out. I found some of them to be really, really comprehensive, and it does depend on the plan. However, you can potentially have a discounted gym membership, or it could be some kind of reduced insurance premium. Sometimes they are giving you some kind of perks, or even contributing money for you if you take some kind of health risk assessment and they incomplete certain activities. That's what that's what they're trying to get you to stay active. Some other things that they have done, maybe providing to you, is some kind of maybe a mindfulness app that you can use on your phone. It could be also nutrition counseling, which is very, very helpful and important. Financial wellness courses, or maybe even some kind of student loan assistance. So I would love to hear what you guys have with your plans that is offered as part of this wellness benefit, in addition to just the regular benefits that you would get, which is going to the doctors. So the next point is, let's talk about flexible spending accounts and also health and savings accounts, because those are also important for you to consider if you are on a certain health and wellness journey. So flexible spending account, or FSA, is allowing you to set aside tax-free money from your paycheck to cover deductibles, co-payments, and other out-of-pocket costs. And also, to use the FSA, you don't need to enroll in the high deductible health plan as you would have to do with a health savings plan. So the one thing that you have to remember with the flexible savings account is that you have to use the money that you have in that account by December 31st of the plan year. Otherwise, the balance is going to be lost. So the great thing about the FSA, if you have that account and you're using it, I encourage you to check your actual benefit and see, and really dive in deep to see what you can use that money for, because you may be surprised. Here's a small list that I have found. You can spend FSA money on glasses, contact lenses, prescription sunglasses, broad spectrum sunscreens, which is what you need in the summertime and in the fall, certain lip balms, sun protection moisturizers with SPF 15 or higher, first aid kit, acne medications, menstrual care products, hearing aids, acupuncture devices, health monitors, and deep tissue pain relief devices, which I think is one of those guns that you can get to help you with your muscle and relaxation. There is the list of the eligible FSA expenses has expanded in the recent years to include a wide variety of clinical services, extensive list of everyday essentials, and several surprisingly eligible products. I'm going to link the list for you guys so you can check it out, but I encourage you to check and see what you have specifically for your plan. So now let's also talk about paying less for prescription drugs. If you have something that you're taking on the regular basis, I encourage you to shop around. And there are some websites such as goodrx.com, singlecare.com, and also Amazon Pharmacy that can help you save money on prescription drugs. So definitely take a look, and also find out if perhaps doing generic and alternative drugs could also be an option for you, because that's how you can also save money. Using a preferred pharmacy. So many drugs also have preferred pharmacies with lower co-payments than other in-network pharmacies. If you have a Medicare Part D prescription drug plan, you can use the Medicare Plan Finder to compare costs for your medication at several pharmacies in your area. Here is another something that I learned recently that I did not know. If you prefer maybe and you get all your prescriptions at CVS because it's closest to you, you may be surprised that if you were to look and actually compare the prices between, let's say, CVS, Walgreens, Costco, and Walmart, the prices are going to vary. They're not going to be the same. So I thought that was interesting too. You can also save money by buying in bulk. If you do a mail order and let's say you get a 90-day supply, it's most likely it's going to be cheaper rather than you just getting a 30-day supply. And you also think of it this way, you don't have to run to the pharmacy every month. That way you're not going to run into the danger of potentially running out of your prescription as well. So check that out as an option. And then because it's mail order, it's just going to get delivered to your home. So definitely look into that. Check out new benefits for Medicare Part D. The Inflation Reduction Act of 2022 included several changes to make prescription drugs more affordable under Medicare Part D. It capped the cost of a monthly supply insulin, as an example, to $35, but not all Part D plans cover all types of insulin. It does depend on, I guess, who you have the plan with. So you can use the Medicare Plan Finder. And yes, I am going to link that for you as well under this video. So that way you can find out what plans are available in your area and what they cover. I want to dig a little bit deeper into the conversation of those tax advantaged accounts that I already mentioned to you. And so we talked about the flexible savings accounts. And the other option is, it's called health savings account. So these work the same way as the flexible savings account, but they actually have much more firepower, so to speak. You can carry forward any unspent dollars forever. So that, like with the FSA, they're actually going to forfeit. You're going to lose your money at the end of December if you're not using them. Since they're individual plans, HSAs are portable, meaning that you can keep them when you leave your job. So that's another important fact. So think of that, it's like a dedicated 401k account for medical expenses. Contributions can earn interest or be invested with a triple tax advantage. Contributions are 100% tax deductible. Gains on investments are not taxable, and withdrawals for qualified medical expenses are not taxable either. In order to contribute in the given year, the HSA must be paired with an HSA eligible, which is a high deductible health insurance plan. And you want to make sure that the plan is eligible before you're going to try to open it or fund it. So I have there's information on the contribution limits as well as the rules, and I'm going to link them under this video as well. Some great ways for you to use your FSA money or your HSA money, that some of them may not be as obvious as you would think. You can actually get a biomarker genetic testing. You can actually purchase baby monitors with them. You can get your eye surgery like LASIK, right? And also, while you can't typically pay for insurance premiums, there are certain exceptions for HSA. You can actually use that money to pay for your long-term care insurance premiums. There are some limits to that. Healthcare continuation coverage like COBRA. Healthcare coverage while receiving unemployment compensation under federal state laws. And also Medicare and other healthcare coverage if you're 65 and older. So definitely some things. A couple of things and couple of hacks that I also found from that podcast that I listened to. You can donate your FSA if you cannot use it, right? So if you don't let your FSA go to waste, you can call a local shelter to see if they need any medical products and purchase them with your FSA money before it expires. And HSA reimbursements do not have a time limit. So you can strategically let your investments compound and you can take withdrawals years later. So you really want to learn a little bit more about the HSA plan versus the FSA plan. Okay, now let's dive in just a little bit more what I learned from that really great podcast and that book from that healthcare investigative journalist. His name is Marshall Allen. So there's a couple of principles that I learned about medical and bills and where you go actually matters. And here's what I learned. So number one, there are substantial price variations for all services. For example, the same procedure 5 miles away may cost you more or less money. Another thing that I learned is that, let's say if you wanted to get x-rays done, it's going to cost you more money to get the x-rays done at the hospital versus if you were to go get them done at maybe a local lab, which makes sense because the hospital is a big building, big institution. They have a lot of overhead, and that's why they're going to charge more for a lot of their services. It is helpful to do your research that can help you in dealing with these wild price variations. Most care is not an emergency, so if you have the time to research, and you can find some valuable options, okay? In the USA, a federal rule requires hospitals to provide clear, accessible online pricing information to patients, including cash prices, Medicare prices, and insurance negotiated prices, right? So you can actually do some research ahead of time, especially if you may be doing some kind of procedure and things like that. You can visit the website of your local hospital. You can call the hospital or the ambulatory surgical center and ask for variations in pricing, cash, Medicare, insurance, and negotiated. Take advantage of different startups that actually have national prices. One of them is called Turquoise Health. Another one is called Health Cost Lab, and I'm going to link them as well. Also find out what the non-local hospital charge. So yes, you're going to have to do a little bit of legwork, but actually it may help you with your decision-making process. Point number two, everything is negotiable. Medical pricing is pretty vague. If prices are negotiable across insurance companies, they are negotiable to you. So take a look and see. Knowing that charges are not the charges and the price is not the price should give you the confidence to negotiate a better deal. Point number three, stop assuming that pricing makes sense. Don't expect a logical rationale for high prices. In most cases, facilities and insurance companies are for-profit organizations, so their prices are not necessarily aligned with the patient. Point number four, take an active role in reviewing your bills. I fully agree with that. According to this journalist's reports and interviews with different experts who review health bills regularly just to see how everything stacks up, most bills are going to contain errors and overcharges. And I can attest to that. I found some things on my daughter's bill when she went to see a hand specialist, and they put in an x-ray in there when I know for a fact that we actually never got an x-ray done. So these errors are compounding, causing more medical debt and leading to debt collection. So what you want to do is to make sure that you're being charged the correct amount. You need to request an itemized bill to see all of the individual charges. And you also want to ensure that the CPT code, which is a current procedural terminology, you'll see each of the items whenever you go anywhere in the doctor's, whether it's a dentist or a regular doctor, each thing that you have, like a office visit or something else, is going to have a CPT code, is that descriptions actually align with the services that you received. Point number five is to make sure that the bill is submitted to the insurance company and adjudicated properly before sending any money. The service provider may have sent you a bill before you actually submitted a claim. So before you pay the bill, wait until you receive an explanation of benefits from your insurance company. Medicare has that as well. What it does, it is going to explain to you how the claims were processed, what was submitted by the doctor's office, what were those codes, what was covered, what was not. Like all of that is going to be on that explanation of benefits. It's going to have service description, provider charges, allowed amount, which is the amount the provider, the doctor is going to be paid, insurance processed or paid amount, and also there's going to be owed amount, which is what the insurance company thinks that the amount you're going to owe to the doctor after everything. So make sure that before you pay anything, you take a look at all of those things. Point number six, talking about overpriced bills, erroneous charges, and denials. Make sure that when you're going to go to battle, as I call it, with the doctor's office or even with the insurance company, make sure that you have all the facts and you have all the information in front of you. Everything is in writing. You are going to argue your case with data and not emotion. So you need to have facts with you. So if you suspect overpricing, you need to find that evidence. If there are erroneous charges, make sure that you review your explanation of benefits. Insurance denial, review what happened with the insurance company. I found sometimes that, if you did not get what is it called, at the head of time, they have to give you permission to go see a specialist. So if you don't have that approval, they may not actually pay for the visit because they didn't give you the approval to see that specialist the first time. So it's not a pre-approval, but so negotiate a better price on your bill politely, but do it with authority. And just keep being firm, being polite, and using facts. So I found the information that they're talking about as there's how to do this as a procedure is also very helpful. And with regards to, as I already mentioned to you guys about the fact that there's no way to really screen the doctors, which doctor in my area is going to be better than other, depending on the specialty that you're looking for. There's some interesting other information that I found. It's called ProPublica Surgeon Scorecard. It's a surgeon scorecard, but is probably not most up to date, but they have some information about finding a surgeon and finding a hospital. I'm going to link that. They actually have some interesting information here. So that's one. And two, I have an article that I found from Consumer Reports that talks about shopping around for lower drug prices. And this is what I was also talking to you about, the fact that the price at Walgreens is going to be different than the price at CVS. So Consumer Reports to the rescue, one of my favorite and authoritative companies. That's what they do. They watch our backs and they do the research. They actually said they sent out secret shoppers to more than 150 pharmacies in 6 metropolitan regions around the US, asking for their retail cash prices for a 1-month supply of 5 commonly prescribed drugs. Right. So basically, if you were to go in and pay for these items without using an insurance, what would that be? The range in prices they found was stunning. The 5-drug market basket cost just $66 in the online pharmacy, but $105 at Costco. The 2 highest priced national retailers are CVS and Rite Aid, had prices closer to $900 for the 5 drugs. So I found that to be very fascinating to take a look at. So I encourage you to also read this article that I'm going to link for you as well. And also they have like an actual spreadsheet, which pharmacies have the best RX prices. So what they did is to find out, Consumer Reports, secret shoppers called around more than 150 drugstores across the US, representing dozens of chain pharmacies, supermarket drugstores, and independent pharmacies to compare the prices for 5 commonly prescribed generic drugs. Okay. And there are some website prices on here. So the first one is called healthwarehouse.com. Second one is Costco. The third one is independent. So it's probably something local that you have, like a little mom and pop pharmacy. The next one up is Sam's Club, then Walmart, then grocery stores. And the last ones on the list are going to be Walgreens, Rite Aid, CVS, and Target. So I found that to be actually very interesting as well, because if we need something, we always just, used to use CVS. And I think right now we get everything on Walgreens. So it definitely pays to have the information. And the more you know, the more power that you have. So that's what I wanted to share with you today. I found this to be very fascinating. I encourage you to take, because as you are heading into your retirement planning, or if you already are retired, a big part of your cost in retirement is going to be paying for healthcare, whether it's premiums, whether it's copays, whether it's other products that you buy over the counter. And of course, the older you get, the more you head into your golden years, those costs are most likely are going to be increased, which means that knowledge is power. The more you know now, the more you have a system set up and the research that you do ahead of time, the better prepared and equipped you're going to be able to be to save money down the road. And that's what I'm always game for, is I'm here to provide you with the research and the resources, and of course to watch your back. So I'm going to link all this information for you. Please take the time to read it. And if you have found something else that is helpful to you, please let us know. Post some links or websites under in the comment section, so that way you can also help out others to help them have a better planning, having better retirement, and enjoy their golden years much more. So that's what I have to share with you today. So I see a couple people that joined us. Hi, Cynthia. Thank you so much for popping back again. All right, everybody. I hope you're having a wonderful Wednesday. I'm going to link all this cool information that I found that I was very excited, and this is why I wanted to share with you today. And also, please let me know what are some of the other things that you would like to learn more about. I actually enjoy investigating and finding things that are going to help you and make your life easier in your retirement, as well as your planning. And I'm sure I'll have some more things that I'm going to dig up for you next Wednesday. So thanks so much for joining me today. I hope you have a wonderful day and a great rest of your week. And I will see you soon again. Bye.